All right. So before I go to the slides, can anyone not see my screen right now? And I can see my chat box right now, so. All right, I will proceed. All right, usual deal. If you're not with the school or the health department in some way, just drop off the call and watch our website for the slides and the recording. Make sure you pass on any information that's needed to anybody. I will be talking a bit about recommendations for sports, so that may be good to get on to your athletic directors and coaches. I was asked to pass on some information about our vaccination clinics. One we have coming up in Isabella County will be on October 28th at the casino from 9 to noon and 1 to 3. To sign up for this, it'll be both a flu clinic and a COVID clinic. This one you can sign up for, and also sign up for any of our other flu clinics on our website. And for any vaccine clinics, there's another link there. If for any reason there's any issues or just to set up any immunization, you can call our offices, and I put those numbers there for you as a reference. For the 10 counties in District 10, there are several community-based flu and COVID combo clinics going on, and those are listed on their event site, so just dhd10.org/events. And if you hover over those events, more information is available. To schedule online, either a flu or COVID vaccine, you can go to the website and then /schedule. To schedule any vaccine, whether it's COVID, flu, or others, you can call their central scheduling number, which is there. And then for the 3 counties in Mid-Michigan Health Department, to schedule any vaccine, COVID, flu, or others, you can call their individual county offices. So I just wanted to share that, as you know, we're talking about boosters, kids vaccines, flu shot, things like that. I did finally remember, and hopefully whoever asked this question is on the call, but there had been a question, I think the last couple of weeks, about when is the 3 months after an illness to be safe from having to quarantine again going to be extended. I did ask, and this is a copy and paste from the response from our state epidemiologist. There hasn't been any talk about extending that. There's no knowledge of anything being discussed nationally about it, but if there is anything, they'll let me know. So for the time being, it's, if you've been infected, you're free and clear for the 90 days. We do encourage people with past infections to get vaccinated sometime before that 90-day expires. I'm sharing this. This is publichealthcollaborative.org. It's just a really good source of communication resources. Main reason I'm sharing it, or thought to share it, is they sent out some nice graphics and social media things that you can share about Halloween safety. But looking at their website, they also had some nice things about children and COVID vaccination, and also some resources for school administrators. They also have some good information on combating myths and misinformation, FAQs and different things like that. But if you're looking for things to fill up your social media page or posters to hang up, that's just a good spot to have in your back pocket. I have gotten a few questions about sports, particularly now that basketball season is starting. The best source of recommendations, there's a really good detailed page with the American Academy of Pediatrics. There's also a statement that's a follow-up from their earlier recommendations on the National Federation of State High School Associations. And then the CDC guidance for schools does have information about testing for athletics. I do have a summary of information from those 3 sites that I'll go over. Most of it's from the American Academy of Pediatrics. This first slide actually is mostly from the National Federation of High Schools. So just like with schools, the rates in sports are usually proportional to community rates. So the more COVID in your community, the more likely you're going to see it in your athletes and athletics. Non-contact sports have lower rates of COVID than contact sports. Outdoor sports have lower rates of COVID than indoor sports. Evidence has shown that face mask use while participating in indoor sports result in COVID rates that are comparable to outdoor sports. So it helps to kind of equalize those 2 risks. Most of the sports-related COVID spread that we do see doesn't seem to be related so much with the actual sporting event itself, but more of the interactions that the teams have with each other and other social contact that the teams have. So that's really where your best effort is focused at. So maintaining social distancing on sidelines, mask use in crowded areas, like sidelines and locker rooms, really making sure people stay home when they're ill, and using proper hygiene when they're gathered together is really the most important thing. Using caution if you have teams eating together, all of those types of things. If you have a big meet coming up, talking to your team about not having big parties, not having big social gatherings, so that they can all stay healthy and be able to play. The recommendations, actually all of the next few slides is from the American Academy of Pediatrics. Everyone involved with athletics who are eligible should be encouraged to receive the COVID vaccine. Consistent and appropriate face mask use, especially by those who are not fully vaccinated, is imperative, and that's their wording. Between practice drills on the sidelines, when arriving and departing from the playing facility, while in the locker room, while not on the playing field, and during shared transportation. So during those high-risk non-playing times. They also go on to say that proper use of face masks for all indoor sports training, competition, and on the sidelines is strongly recommended for people who are not fully vaccinated, and for all athletes, regardless of vaccination status in counties with substantial to high transmission, which is all of us right now. Face masks should be worn by coaches, officials, and spectators, and any other non-athlete at all times. If face mask is removed for a break, the athlete should make sure they're at least 3 feet away from other people, and make sure you have extra face masks around, because if it becomes saturated with sweat, it needs to be changed immediately because it's no longer effective. If you have any outdoor sports still occurring, mask use becomes less important. However, they should wear face masks if they're in group sessions or sidelines or huddles or things where they can't keep at least 3 feet apart from each other. So times when people should not wear a face mask is when there's a choking hazard. So competitive cheer where they're tumbling, gymnastics where they're using different type of equipment, wrestling, actual wrestling competitions or contact, and those that are swimming or diving where the mask will become saturated. Other things that they recommend is continuing to reinforce and teach appropriate hand hygiene and respiratory etiquette, continuing to teach and reinforce and require that anyone involved with the athletics do not attend or participate if they have any signs or symptoms of COVID, and not return until they've tested negative. Consider keeping your practice groups in designated pods or assigned groups that are consistent, so that if there is illness, it's hopefully maintained to small groups rather than a team-wide outbreak, or you may be able to just quarantine selectively. Try to prioritize non-contact activity as much as you can, like conditioning and drills. That's not always possible, of course. Make sure that frequently touched or used objects are cleaned at least once a day, if not more frequently. avoid shared equipment or shared areas like locker rooms as much as possible. Do not have shared foods, avoid potlucks, avoid pizza parties, things like that. And my biggest pet peeve, don't have shared water bottles. I always cringe when I see the big bucket of shared water bottles going around. I know people always say, well, they don't touch their mouth, they squirt the water in, it doesn't matter, they're breathing out on them. Not everyone uses them very well. And this is how we can get meningitis, strep throat, anything really. So make sure people have their own water bottle and that they're labeled properly. When possible, the areas that athletes might use, like weight rooms or other small spaces where there's not going to be good ventilation or they just can't distance from each other, should be avoided or should be altered or used in a different way. And if you can get better ventilation, like opening doors or getting a HEPA filter, things like that, that is also preferred. Make sure your spectators are encouraged to wear a mask. I know a lot of this is wishful thinking, but I still have to say it. All spectators should wear a face mask when attending sporting events. Outdoors, that may be optional, just depends on how crowded the setting is. If you have a packed stadium, masking would be recommended. No one should attend a sporting function as a spectator if they have any signs or symptoms of COVID or they've been exposed to COVID. And parents or spectators, those that have high risk of complications from COVID, may want to rethink whether they should be attending things in person. You may want to consider continuing to offer streaming your games online so that grandparents or parents with health conditions can continue to watch events that way. So the CDC recommendations for testing state that schools should consider having screening testing for participants in higher risk activities like athletics who are not fully vaccinated. It should include everyone involved, whether it's students, coaches, trainers, volunteers who are not fully vaccinated. Again, those who are fully vaccinated do not need to participate in screening testing, meaning testing of asymptomatic individuals on a regular basis looking for illness. One recommendation is testing individuals within 24 hours before a large event and or at least once a week. You may consider less frequent testing if it's a lower risk sporting activity, and I have some information about what those are in a minute. The CDC, and I have information on this in a bit too, but the CDC actually does recommend canceling higher risk activities or having them virtually, meaning like there's no audience, when your transmission levels become higher, which we are all in at this point. So this is the table from the CDC. So again, this is their recommendations. I don't expect that we will have anyone following these recommendations, but I just wanted to share them. So when you have substantial transmission, testing would be more frequent. They actually recommend with high transmission, which again, the whole state is currently at that level, canceling sporting events that are high risk, which would include indoor activities, or having them virtual unless everyone is fully vaccinated. So I did include this list here. It's coming from an older publication of the NCAA, but at least just to give you an idea of where some of the risk levels are considered. It is hard to really pigeonhole things in different risk categories because you may be following different mitigation strategies or using different methods to prevent spread of illness. So it at least gives you a bit of an idea of what to do. Again, if you're using masks and testing and doing other things, the risks can be definitely lower. But again, these are the recommendations for athletics at this time. There are no requirements like there were last year, but these are recommendations. Hopefully, with following as much as you can, you'll keep your athletic programs going as much as possible. Getting into our data now, our hospitalizations in our areas are pretty stable to down just a little bit. There's a few less in the hospital, a few less kids in the hospitals in our area than there were last week. For our county data, you can go to mystartmap.info. Our case rates for kids that are school age, so 5 to 18 years of age, for most of our counties seems to be leveling out. Some counties are higher, some are lower, but hopefully we're seeing a trend, but you never know. So this is the case rates or the case counts, absolute counts for all 19 counties involved in this phone call. Next, I'll show county by county. There are dramatic differences from some counties to counties in the y-axis or the vertical axis, so just pay note to that as we go through. But this is Aranac County, and this goes from mid-July to or through this past Tuesday, so just a couple days ago. Clare County, Gladwin County, Isabella County, Osceola County, Roscommon County, Clinton County, Gratiot County, Montcalm County, Crawford County, Kalkaska County, Lake, Manistee, Mason, Macasta, Osaki, Nuevo, Oceana, and Wexford. So these are slides from this week's state data and modeling report. The test positivity is up just a smidge from last week. Our case rate has increased. It's 315 cases per million. Last week it was 304. It's been a steady increase since the low in June. 10 to 19-year-olds continue to have our highest case burden. The CDC transmission level is 302 cases per 100,000 over 7 days. Just as of note, the US on average in our whole area is 142 cases per 100,000. So we are twice as high of a transmission rate as the country as a whole. So Michigan, as you recall, we kind of hit this surge later. Unfortunately, we're still surging while everybody else, for the most part, is starting to drop off their surge. The outbreak number has only increased about 3% from last week. At the time this image was taken, which was on the 17th, Leelanau County was in the substantial rate. As of today, this whole state is red again, so everybody's in high transmission level. Again, quite high, steady growth. The positivity rate, all of these indicators are still just kind of gradually increasing. We continue to have these occasional little dips like we did here the end of September. We'll hope that this one stays down and doesn't bubble back up like it did after the end of September. So hopefully we'll start going down here soon. This image was provided last week as well, but just to kind of show you where Michigan is, this blue line compared to the rest of the country. So we continue to go up, or at least stay up, where the rest of the country has started going down. So we're just behind everybody at this point. These are the case rates per age group. This blue line is the 10 to 19-year-olds, so they continue to have the highest case rate per age group. There has been an increase lately of the 80-plus-year-old crowd, so we don't like to see that because they certainly have higher risks. So if you know any 80-plus-year-olders out there, hopefully they'll be getting in soon to get their boosters. This is a 5 to 18-year-olders specifically. So the last one had our 0 to 9 and 10 to 18. This has specifically the 5 to 18-year-old age group, and really showing that pretty steep increase since they returned to school. This is their breakdown, and by there I mean U of M School of Public Health is trying to track data of 5 to 18-year-old case rates in counties that have mask requirements versus those that don't have mask requirements. When I was doing research for today's presentation, I noticed there was actually quite a bit of press coverage of this topic, and they were citing research published by U of M, and this was all that they were really citing as the research published. So I think we all know it's not the greatest data in the world, but it does seem to be a consistent pattern. Unfortunately, still a lot of people utilizing the ER for diagnosed COVID, so it is taking up a lot of that resource. Still seeing a lot of hospitalizations for COVID positive individuals. Again, the outbreaks were up only 3% overall. Over half of all new outbreaks, 61%, were in institutions, whether they were child care or K through 12 institutions that cared for children. So there were 854 new outbreaks reported in the prior week, and over 2,500 ongoing outbreaks. So I graphed these out again. The green line are the ongoing school outbreaks. The yellow line are the new outbreaks that are reported each week. And this is the number of individuals associated with ongoing and new outbreaks. So to me, it appears that there's been bigger outbreaks potentially in addition to just the number of outbreaks. Last week, I think we got a question about vaccination efficacy, so I included that information in this week's slide deck. So between the beginning of the fully vaccinated potential and the 12th, just under 7% of all of our cases have occurred in those who are fully vaccinated. So less than 1 in 1,000 people that are fully vaccinated have gone on to develop COVID so far in the state of Michigan. This is a slide showing national information. So on the left here, between April and September, this dark line are the case rates for those who are unvaccinated, and the lighter blue line are the case rates in those who are fully vaccinated. So you had a 6 times greater of getting infected or testing positive if you were not vaccinated. On the left, it's showing the hospitalization rate for unvaccinated in the blue versus vaccinated in the green from January through August. So you had a 11.3 times greater risk. Oh, I'm sorry. So you have much, much greater risk. It says 12 times higher risk of being hospitalized if you're unvaccinated. The 11.3 times is actually your risk of dying from COVID if you're unvaccinated. Now, statistics can cause some confusion, and we've heard quite a bit people saying, well, almost everyone that I know that's been infected has been vaccinated. Or more people, I know more and more people that have been vaccinated that are getting sick. So this tries to explain it. It's still a little confusing, but basically, if we assume that the vaccine reduces your risk of getting infected by 80%, which is a reasonable estimate, and of everyone in the population, the risk of getting infected is 2.5%, which is actually a pretty reasonable estimation. This is a kind of a visual explaining this. So if you have 2,000 people, half are unvaccinated, half are vaccinated, your unvaccinated group, 25 of them would get infected. In your unvaccinated group, only 5 would get infected, and you'd actually have 20 then who were prevented from being vaccinated. So in a 50% vaccinated group, you would prevent 20 infections. If you vaccinated 90% of your population, you would prevent 36 infections. However, you'd have 9 people infected that are vaccinated simply because there are more people vaccinated. However, you're preventing many more infections. It's just, yes, there are more people who are vaccinated that will get infected just because there's more people vaccinated. If you vaccinate everybody, you're going to prevent 40 infections, which is more still. However, you'll have 1 more case in a vaccinated person. So again, yes, as you vaccinate more people, you get more infected vaccinated people, but you're still preventing more cases. Plus, what this slide set doesn't take into account is as you get more and more infected people and more illness in a community, there's just going to be more and more spread as well. This is a very difficult concept to explain to people, I have found. But if this is something that you ever do need to explain, hopefully these images do help. So just some updates on vaccinations for kids. Next Tuesday, the VRBPAC committee for the FDA will discuss the topic. The following Tuesday and Wednesday, the CDC committee, the ACIP, will discuss the topic. And then hopefully that day or the next day, we'll have the official green light to move forward with vaccinating this age group. We have already been receiving instructions and go-aheads, actually given instructions to start ordering vaccine so that everything's in motion for this age group. This slide, again, is from the state. So this is kind of what the state is doing to work on rolling out this vaccination, but trying to get more and more pediatric offices signed up to vaccinate, our school-based health clinics registered to vaccinate. Most of ours already are. I think all of ours are. But again, just getting them set up and ordered. Our FQHCs set up to order, we're ordering. So basically, everything's being done ahead of time with the assumption that this will all be approved seamlessly and ready to go around November 3rd or 4th. So that is all that I had for my slides today. Let me stop sharing. All right, and I'll get to the questions. There's only 2 questions right now, so if you have any, please throw them in there. The first question is, you mentioned to avoid shared equipment. Does this include basketballs and volleyballs? I thought infection due to transference from objects was not as big a concern as once thought. It's not, and I just put that in there because it was in the American Academy of Pediatric material, so I didn't want to edit out anything they had in there, but it's not as big of a concern. The bigger concern is really sharing things that are more personal objects, like towels, water bottles, anything like that that might be more of a direct contact to the face. With basketballs, volleyballs, those kinds of things. The bigger importance is hand hygiene, so you may want to encourage more hand sanitizer use on the sideline because that has to then get from their hands to their mouths. Are the case counts compared between 2020 and 2021 taking into account how many schools were open at the start of each year? So those cases are only from county compared to each county. Our counties, for the most part, all of our schools were open, only closing if they had to for outbreaks. A lot of the counties in the southern part of the state, the larger counties, were virtual for a long time, but we only had a few schools that started out virtual and then opened later. I think almost all of our schools started in person with a virtual option. But we're just providing that for your comparison. We're not trying to draw any conclusions necessarily. We're just trying to compare it give you that information, because that's information you can't find on your own. I have to pull it from a password protected site. I was told MDHHS and Michigan High School Athletic Association are talking about issuing specific guidance for winter sports. Is this true? Should we expect specific requirements or guidance from them? I have no idea. I've not heard anything like that. If anyone else has, they can chime in, but I went to the High School Athletic Association's webpage today to try to see if they had any guidance I could pass on to you, and I found nothing. So I don't know if anyone has heard anything like that. It doesn't mean it's not true. We're often not told things until after the fact. So for contact tracers who will be testing in the schools, is there a specific disposable gown? So I'm guessing like for the HRAs or for your staff or anyone, any gown is fine. And typically it's not really even that critical since if you're doing screening testing. If you want more specific information, feel free to email me and I will pull the recommendations off the CDC. If you go to the CDC's healthcare provider webpage and look up their PPE recommendations, if you use what's recommended for a healthcare provider, that will be more than sufficient. Again, the biggest issue is protecting your eyes, nose, and mouth. Other than that, the rest is a bonus. There's not a lot of concern from getting it on your clothes, because again, you'd have to touch it and get it in your eyes and mouth and those kinds of things. But again, if you go to the healthcare provider section on the website, the CDC website, and you can find that information. Again, I know it's a pain to navigate that website, so if you want to email me, I'm happy to find that for you. The biggest risks are those working like in the ICU or the ER, where the amount of virus they're exposed to is much higher. So, any other questions? And if you're on the phone, feel free to unmute yourself. All right. Well, we will get these slides and the recording out to you guys and post it on our website. Otherwise, enjoy the rest of your week, and we'll see you next Thursday.